Metformin is used to treat high blood sugar levels that are caused by a type of diabetes mellitus or sugar diabetes called type 2 diabetes. With this type of diabetes, insulin produced by the pancreas is not able to get sugar into the cells of the body, where it can work properly. Using metformin alone with a type of oral anti-diabetic medicine called sulfonylurea or with insulin will help to lower blood sugar when it is too high and help restore the way you use food to make energy. Many people can control type 2 diabetes with diet and exercise. Following a specially planned diet and exercise will always be important when you have diabetes, even when you are taking medicines. To work properly, the amount of metformin you take must be balanced against the amount and type of food you eat and the amount of exercise you do. If you change your diet or exercise, you will want to test your blood sugar to find out if it is too low. Your doctor will teach you what to do if this happens. Metformin does not help patients who have insulin-dependent or type 1 diabetes because they cannot produce insulin from their pancreas gland. Their blood glucose is best controlled by insulin injections. Indications: type 2 diabetes mellitus without a tendency to ketoacidosis, especially in obese patients with the ineffectiveness of diet therapy, in combination with insulin in type 2 diabetes mellitus, especially with severe obesity accompanied by secondary insulin resistance. How to use. The dose of the drug is set by the doctor individually, depending on the levels of glucose in the blood. The initial dose is 500 to 1000 mg per day, 1 to 2 tablets. After 10 to 15 days, a future gradual increase in dose is possible depending on the level of blood glucose. The maintenance dose of the drug is usually 1500 mg to 2000 mg per day, 3 to 4 tablets. The maximum dose is 3000 mg per day, 6 tablets. In elderly patients, the recommended daily dose should not exceed 1 gram, 2 tablets. Metformin tablets shall be taken whole during or immediately after a meal, with a small amount of liquid, a glass of water. To reduce side effects from the gastrointestinal tract, the daily dose shall be divided into 2 to 3 doses. Due to the increased risk of developing lactic acidosis, the dose of the drug shall be reduced in severe metabolic disorders. Contraindications: renal dysfunction, congestive cardiac failure needing drug treatment, hypersensitivity to metformin, acute or chronic metabolic acidosis, impaired hepatic function. Precautions: age greater 80 years until renal dysfunction ruled out, acute myocardial infarction, radiological studies involving iodinate contrast, surgical procedures, alcohol intake. These contraindications precautions have been increasingly challenged by recent evidence, although this evidence is mostly from observational studies. Side effects: along with these needed effects, medicine may cause some unwanted effects, although not all of these side effects may occur. If they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur. More common: abdominal or stomach discomfort, cough or hoarseness, decreased appetite, diarrhea, fast or shallow breathing, fever or chills, general feeling of discomfort, lower back or side pain, muscle pain or cramping, painful or difficult urination, sleepiness,